Good morning, everyone. This is our August 30th, 2021 meeting of the Orange County Legislative Delegation. It is called to order. Good morning and welcome to all who are attending virtually or watching on Orange TV. I am Senator Randolph Bracey, Chairman of the Delegation, and I will be presiding over the meeting today. I would like to call on Senator Linda Stewart to offer the invocation. That was supposed to be Representative McCurdy. He's not here yet. And after which we will remain for the Pledge of Allegiance. Senator Stewart.
I'm here, Senator Bracey, by the way.
Oh, I'm sorry. Representative McCurdy, would you please offer the invocation?
Sure. Let us pray. Dear Lord, thank you for blessing us to see a new day. Thank you for all you have done and all that you will do. We pray for all of our servicemen and women here and abroad, our neighbors in Louisiana and those dealing with the negative effects of COVID-19, our neighbors in Haiti. Pray for every federal, state, and local elected official charged with the task of making decisions for all of your people. And finally, we ask that you bless this delegation, bless this meeting, and continue to bless your people. In Jesus' name, amen.
Amen. Thank you for that prayer. And I will be calling for a moment of silence. Thank you for that, Representative McCurdy. Due to the Afghanistan military killed and also our neighbors suffering in Louisiana and Mississippi. So if you would, for a quick moment, let's take a moment of silence. Thank you. Let us keep those affected in our prayers moving forward. Now we will have the Pledge of Allegiance, and I will start it off, and please say it with me. I pledge allegiance to the flag of the United States of America and to the republic
for which it stands,
one nation, under God, indivisible, with liberty and justice for all. Representative Travaris McCurdy, Delegation Secretary, please call the roll.
Chair Bracey.
Here.
Senator Stewart.
Here.
Representative Brown. Senator Torres. Representative Escamani. Representative Goff-Marcel.
Here.
Representative McCurdy, here. Representative Morales. Representative Placencia. Representative Smith.
Here. Good morning.
Good morning. Representative Thompson. And Representative Truenow.
Thank you. Thank you, Secretary. As I said, I am Senator Randolph Bracey, representing District 11. I would like to give each member of the delegation a minute to briefly introduce themselves. Let's start with Senator Stewart, and then we'll go to Representative Escamani.
Well, good morning to everyone. I am the senator from District 13, which is the central and eastern part of Orange County until the redistricting occurs, and I am going to look differently probably. I serve on 7 committees, and one I am vice chair of the Environmental Committee, and I'm anxious to hear all your concerns today and see if there's some way we can move forward with your concerns. Thank you.
Stewart and Senator Bracey. My name is Anna V. Escamani. I'm proud to serve District 47 in the state legislature. Currently, that district encompasses the city of Orlando, Winter Park, Belle Isle, and Edgewood. It's an incredible place to call home. I live in Thornton Park, so kind of in the middle of it, and have been in this place of service since 2018. I do serve on several committees, including serving as the ranking member for both Ways and Means and the Regulatory Reform Subcommittee. We haven't gotten our committee assignments yet, so that could change. But for the time being, those are my committees that I serve as ranking member. And of course, very, very excited to hear what is on your mind, to get the update from our local government partners, and do what we can to serve you in the legislature.
Thank you. Representative McCurdy.
Thank you, Chair Bracy. Good morning, everyone. Representative Travaris McCurdy, representing Florida House District 46, which includes all of West Orange, or portions of West Orange County, from the Paramore I-4 line to Hiwassee in the Pine Hills area. I have 10 zip codes, and freshman representative served on 3 education committees out of my 4 this past session. So looking forward to see what committee assignments I am afforded this upcoming session, and interested, as my colleagues have stated, to hear the community's concerns and just some things that we need to look forward to and put on our radar for the upcoming session. Very excited to be here this morning, and thank you all again.
Thank you. Representative Carlos Smith.
Morning, Orange County. I'm State Representative Carlos Guillermo Smith, pronouns he, him, L. I represent House District 49. That's on the east side of Orange County. So the neighborhoods include Waterford Lakes, Union Park, Rio Pinar, UCF, the University Corridor, and Lake Pickett. I serve as the Democratic ranking member on the State Affairs Committee in the House, as well as the Professions and Public Health Subcommittee. And I'm very happy and excited to hear from the public today and hear from everyone else as well on what we should be focused on in the 2022 legislative session. Thank you.
Thank you. Rep. Joy Golf Marcel.
Hi, good morning. I am Representative Joy Goff Marcel, representing Florida House District 30, which is parts of Orange and Seminole County. I was born and raised in my district, and my husband and I chose to raise our 3 children here. I love my district. I proudly serve it, and I look forward to hearing from everyone today. Thank you.
Thank you. Have I missed anyone that's on the call?
It's
Oh,
Representative.
go ahead, Representative Brown.
Good morning. It's Representative Camilla Brown here, members. Good morning to those that are attending also. Here to speak. I am State Representative Camilla Brown, proudly serving House District 45. I've been elected since 2016. I serve the areas of the Ocoee area, East Winter Garden, Pine Hills, Lockhart, Rosemont, and parts of the Orla Vista area in South Apopka. In the Florida House, I serve as the Democratic Leader Pro Tem, and I serve on the Healthcare Appropriations Committee, where I am Democratic ranking member, the Commerce Committee, Insurance and Banking. I serve on the Tourism, Infrastructure, and Energy Subcommittee, as well as the Rules Committee, and I'm happy to be here this morning. Look forward to hearing your comments.
Thank you. Did I miss anyone?
Representative Thompson.
Representative Thompson, go ahead.
Good morning. I am Representative Geraldine Thompson. I serve House District 44, which is West Orange County. It includes the communities of Winter Garden, Windermere, Dr. Phillips, the Tourism Corridor, I-4, etc. And I'm glad to be here this morning and to hear your concerns. Thank you.
Thank you. Did I miss anyone?
Representative Morales here.
Go ahead, Representative Morales. And my apology, I'm trying to pull up my screen and I can't see it. But go ahead, Representative Morales.
Yes, good morning to all. I'm Daisy Morales. I represent House District 48, which serves the close to the International Airport. I've been in Florida since 1989. I've made Florida my hometown, and I serve in 4 committees, 2 on education, 1 on financial and facilities, and 1 on agriculture and natural resources. And I look forward to hearing your concerns today. Thank you.
Thank you. Did I miss anyone?
True now.
Go ahead, Representative True now.
Good morning. I look forward to hearing from everybody today. And it's a wonderful, magnificent Monday, right? Thanks.
Thank you. And I am Senator Bracy, representing West Orange County, Ocoee, Apopka, Winter Garden, parts of Orlando, and very happy to be here. Look forward to hearing your concerns. We serve you, the community, and so this is why we do this. And I'm excited to hear from you. So thank you for those who have tuned in. Have I missed anyone? Okay. Well, this morning we begin the presentations with a COVID update from some of our local experts, followed by some local elected officials and representatives from government-related entities. Later this morning, we will also elect delegation officers. The newly elected officers will transition to their new duties at the conclusion of our meeting this afternoon. Before we start, let me ask delegation members and those addressing us to keep your microphones muted until you're called on to speak. We will now receive an update on the COVID pandemic from local experts. First, we will hear from Dr. Vincent Hsu, Executive Director of Infection Control with Advent Health. Dr. Hsu, you are recognized.
Thank you, and thank you all for inviting me to this important meeting. I just wanted to give you an update on where we are, especially as it relates to our hospitals during this pandemic. As you are all aware, we have seen a significant surge at all our Advent Health hospitals. And I just wanted to point out that I'm going to be talking about numbers as it relates to all our hospitals in Central Florida. So it's all the way from Flagler County all the way down to Polk. Orange County, of course, is in there, but it's a larger swath of hospitals than just Orange County specifically. We did peak at our hospitalizations peaked at 1725. And so the good news is that we are dropping down. It peaked last week, and we're seeing a significant drop, which is really good. And it's not dissimilar from what other observations have seen from India and as well as the UK. The number of patients in the hospital dropped quite a bit. We're now at 1386 overall. And the number and the percentage of new admissions for COVID has dropped down to 25%, and it had been as high as 40%. But I also wanted to share with you that the surge capacity still remains quite critical, even as our cases have fallen. We still have a significant number, almost 400 patients with COVID in the ICU. 325 or so of them remain ventilated, and still a lot of ICU patients that are not actually in ICU beds, but because we're still full, they're in non-ICU beds. The staffing remains stretched. So even though we're seeing the light at the end of the tunnel, there's still a lot of work to do. One of the particularly important issues that we have noticed is, and this is not unexpected, is in the aftermath, there are increasing numbers of deaths that have occurred. And this is something that you will expect as patients remain in the hospital longer. Some of them have just not been able to get off the ventilator. So we have seen an increase in deaths. Most recently, there's been in our hospitals over 200 deaths in this past week. And so this is something that we has also unfortunately contributed to the decreased census. We've seen increased numbers of refrigerated trucks. Our morgues are full, and we're getting more capacity to try to manage these numbers. So we are continuing to manage that. Hopefully, again, as we move forward, we'll see a decrease in the number of deaths as well as this surge starts to go down. So a lot of work still going on in our hospitals. We are also, of course, continuing to keep track of what's going on with the vaccination status and doing everything we can to get vaccinations moving even further for first doses, and then as well as the third doses for immunocompromised patients. Advent Health has already continued to focus on vaccinating those individuals. Once we get FDA authorization to start moving on these booster doses, which is anticipated early next month or mid next month, we will do that as well. So we want to focus on doing what we can to incorporate booster doses. Flu campaign is also it will be underway shortly as well. We know that influenza season, there's always a concern about a twindemic where you have number of influenza cases that will surge in the winter. We expect this to be a severe season, given that we had very little in the way of flu last season. So what we want to try to do is to make it as easy as possible for our team members and in the future, the community, for them to get their flu vaccinations as well as COVID boosters when they become available. So we do see light at the end of the tunnel. We want to continue to focus on vaccinations and take care of those that are ill. We are glad to see the surge going down, but there's still a lot of work to do. So that is my report, and I'll turn it back to the senator. You're on mute, Senator.
Thank you. Next, we will have.
Wait,
Question, if before we can move on, if that's okay.
Yes, go ahead.
Thank you very much for the presentation, Doctor. A quick question for you. I know that there was some reporting late last week about the morgues being at capacity, and specifically it was reported that without a disaster declaration, that you were not able to request additional assistance with being able to make sure that you could store, unfortunately, bodies of folks who were deceased. Can you walk us through what that means? Is it a disaster declaration versus a state of emergency declaration? And who does the state have a role in that? Is that something that the governor can do to make sure you have the support that you need?
That's a good question, Representative Smith. I actually do not have the information specific to what we need as far as disaster declaration or state of emergency is concerned. I do know that we are receiving, we ordered more refrigerated trucks. We have the Central Florida Disaster Medical Coalition providing additional temporary refrigerated morgue space. So as far as capacity, we are handling we're handling our own right now. There could be more that we could perhaps get if there was perhaps a disaster declaration, but I am actually not too clear on exactly what that would entail.
Thank you. And one quick follow-up, if I could. My question has to do with reporting. I know during the state of emergency, for when we were in a state of emergency as a state, that hospitals were constantly reporting to the state, which came out on the daily dashboard, local hospitalizations and local deaths. Where do you report that information now? As far as, for example, if I wanted to find out how many pediatric hospitalizations exist within the Advent Health system for COVID, where do I go to find that information? Where are you reporting that data?
Well, we have a reporting that occurs at the federal level. As far as the state level, you're right. I don't actually, we continue to report our data as they're requested. I do have a working relationship with some of the schools, school districts, for example, with OCPS. So we do report some of the data to Orange County Public Schools. But certainly, if there is a need to contact us directly to provide data, we'd be happy to do that for you.
Thank you. Any other questions?
I had requested through chat. Is that not the best way to do it? I can just call my name out when I'm ready to give a question, but I do have a question for the doctor. And I want to thank Advent for all the hard work and certainly tears that happen at your facility. But I just wanted to know, have you treated anyone who has ingested ivermectin?
I personally have not treated anyone specifically who has taken doses of ivermectin. We have heard reports, of course, of folks that have taken ivermectin, and perhaps the most concerning issue is ivermectin that's not even intended for humans. It's intended for livestock and other issues. So we know it's an issue. I'm sure some of my providers might have been taking some of that, but I myself haven't had an experience with that. I do still see patients in the hospital with COVID, but my clinical time taking care of these patients is somewhat limited because of my other duties. I just wanted to respond to Dr. Smith, to Representative Smith's comment about reporting. I wanted to let you know that we do also report to the Florida Hospital Association some of those numbers as well.
Hey.
Yes, go ahead.
Thank you so much. Thank you so much, Doctor, for being here and for facilitating many conversations with us to keep us informed. And my question is around, well, first of all, so much thought going out to our healthcare workers who I know are fatigued and tired and have been navigating this pandemic for a year and a half and more now. With the FDA approval of the Pfizer vaccine, I'm curious, how do you see that at all impacting the path with COVID-19 in Central Florida, even for your own healthcare workers? Have they been comfortable getting vaccinated? What hesitancy do you see? And what can we do better as lawmakers to try to combat vaccine hesitancy and encourage folks to trust science and to actually be vaccinated to try to stop the spread of COVID-19?
Yeah, that's an excellent question, Representative Escamani. We are, just like many other healthcare systems, not just in Florida, but throughout the nation, we're working to combat vaccine hesitancy among our own staff members. We continue to do that, by using the avenues that we believe best resonates with them, using their people that they know, that they trust, their circle of friends, because that's really what it boils down to. We continue to use as much in the way of data, but I think another big issue is just the stories. And as unfortunate as the surge has been here in Florida, we have actually been quite successful in getting additional members of our team vaccinated, because they have seen now firsthand what can happen, especially in unvaccinated people who have been admitted to the hospital, and the number of severe illnesses and deaths that have occurred. So that has resulted in an increased number of vaccinations. So using those modalities really is helpful. Above and beyond that, then I think it's going to be up to others to help push it even further. And I recognize that there's a lot of different approaches to improving vaccinations, perhaps in a non-voluntary way, but we'll have to see how things move on from that standpoint. But right now, we're just trying to push voluntarily as much data, but stories and use that as a way to increase our vaccinations, not just in our health team, not just with our healthcare workers, but in the community as a whole.
Thank you. So what I'm hearing is peer-to-peer education and peer-to-peer relationships are probably some of the best ways to try to combat vaccine hesitancy. And so trying to amplify personal stories and, not judge or shame folks, but really actually try to figure out what the hesitancy is and try to overcome that together.
Absolutely.
Not sure what happened to Senator Bracy, but if nobody else has any questions for the doctor, I believe we should move on to Dr. Jenkins.
Good morning, and certainly want to add my thanks to Senator Bracy and the entire delegation. Thank you for always supporting Orange County Public Schools and the youth of our community. I want to also note that you will have an opportunity in coming weeks to meet our new Senior Director of Government Relations. That's Jason Lagash. He works for Scott Howitt, who most of you know as our Chief Communications Officer. So look forward to those opportunities in the coming weeks. Also like to thank Dr. Hsu. Our entire Medical Advisory Committee has been invaluable in helping OCPS navigate this unusual time of a pandemic in a K-12 education system. So I want to acknowledge him, as well as Dr. Pino and the FDOH here in Orange County, as they have been incredible partners to work with us on behalf of our students and our schools and what needs to be done. Let me just mention as well, so folks are familiar, Orange County Public Schools, we are the 9th largest in the country, and we serve nearly 200,000 students. Here's the thing, they are an international community. They come from 197 different countries. They speak 172 different languages and dialects. And about 70% of them qualify for free and reduced lunch. That's an indication of poverty level amongst our community. And I have no doubt that this pandemic has exacerbated those numbers, including the number of homeless families that we serve, which exceeded 7,000 last year. So I want to paint that picture first of all, what an incredible opportunity we have a privilege to serve this beautiful tapestry of students. We like to remind folks all the time, we have homeless students who are gifted, and we may have affluent families who have children with unique abilities or severe handicaps, you might say. And so we love to think of our entire population as this beautiful tapestry of all kinds of needs and talents among our students. Every day we serve about 213,000 meals, and we transport about 70,000 students. I mention that because when we consider the pandemic and what has happened to lower wage earners in the community and underserved populations, we certainly have a concern around our bus drivers and our food nutrition workers as well, keeping those vacancies filled so that we can serve our children. So in case you hadn't heard, we are under a mask mandate now. The board authorized me on August 24th. We have mandatory masks in place for all of the adults who are on our campus, employees, as well as anyone else who might be on our campus, and all of our students, unless they have a medical exemption. That is a note from a medical doctor, nurse practitioner, or physician assistant that exempts them from wearing the mask. That mandate is in place through October 30th. At that time, we will certainly have some review before October 30th to determine how we move from there. Considering a pandemic being still gripping our community, we have had 3 weeks of school with fairly uneventful days for our students. But we've had record-breaking numbers of COVID cases for our students as well. Our Mondays, for the last 2 Mondays, we come to 382 and 239. Those were record-breaking numbers of student COVID-19 positive cases. They continue to climb, Mondays being our highest number. I would invite anyone from the delegation, check our ocps.net, and you can see that scoreboard. The dashboard is updated every evening just before midnight. And so if you look at it now, it only has last night's numbers. Tonight, when it updates, we suspect there'll be another surge. Grand total of COVID cases, 3,289, including 631 employees and 2,600 students. So we absolutely needed to have some intervention to mitigate, try to help bring those numbers down in a community where last time Dr. Pino reported was nearly 20% in positivity rate. And so we will work tirelessly with our schools and with our parents. We acknowledge everybody's not happy about that mandate. Leon County's judge did actually rule in favor of the parents concerning the mask mandate. And so we will wait to see if the state and the governor decide to appeal that ruling. But in the meantime, it was good news on Friday that we are within following the law to actually have that mandate in place. It's our greatest mitigation. We are also very happy about our partnering with the Department of Health Orange County around vaccines. In Orange County, we offered a $200 supplement for our employees to get the vaccine, and we're right at about 65% now actually having both doses of that vaccine. Again, our greatest concern, and we're doing some partnerships to help these populations, but bus drivers in particular, we're seeing lower numbers, around 30%, 35% of vaccination. And it's because of that partnership with Dr. Pino, we have additional testing for the community in several of our schools, as well as vaccines being offered. I mentioned the Judge Cooper's ruling on Friday, we also on Friday, just about the time that case was wrapping up, did receive a letter from Commissioner Corcoran indicating his disappointment that Orange County's board was not adopting what he believed the emergency rule required of us. And based on his authority that he would be initiating an investigation about whether or not we were in compliance with the emergency rule. This is about 12:30 or so. It's about the time that the hearing was wrapping up, and it seemed fairly clear to most people watching that the judge was going to rule in favor of the parents. So by 5 p.m. Wednesday, this letter is public. We've had media already request it. By 5 p.m. Wednesday, we'll need to give a response to the commissioner about how we intend to comply with Florida Department of Health emergency rule. And then if not, they will withhold, he will recommend to the school, to the State Board of Education that they withhold the salaries, withhold funding equal to the salary of school board members here and any other sanctions authorized by law. So that letter was received on Friday, and we will certainly have a response for the commissioner by Wednesday at 5 p.m. Senator Bracy or whoever's in charge now, that is my report.
Representative Goff-Marcel, you are the vice chair and should probably conduct the meeting until Senator Bracy comes back.
I was just texting him to see what happened there. Thank you. Okay, we need to, thank you very much, Dr. Jenkins, for your report. Next, we will hear from
Chair Goff-Marcel. I'm sorry, I do have a question.
Okay. Yes, please, Representative Smith, go ahead.
Thank you, Dr. Jenkins. And first, I just want to thank you and the school board for putting kids first and not prioritizing politics, because the health and safety of our kids and our teachers is so important. So I applaud you for making that mask mandate. My question is about this letter. So my understanding is that in Judge Cooper's ruling, not only did he strike down the ban on mask mandates, but am I recalling correctly that he specifically said that any punishment of a school district, including the defunding of the school budget, whether it be for salaries or otherwise, that punishing school districts would also be an illegal act by the state? Did the judge say that?
So there are lots of interpretations, Representative. I believe it is best to wait for the written order to come down today to make it official, but we believe you are correct in your assumptions.
Chair Goff-Marcel.
Let me also note the letter came to myself and to Board Chair Teresa Jacobs. It was addressed to both of us, and I have to tell you, our board has been incredible to stand up and lead on behalf of our community's children in the midst of pretty hectic political fray that's been going on here. So commendations to our school board for leading incredibly well and with courage and with determination during this difficult time.
I have a question, Chair Goff-Marcel.
Thompson.
Thank you. Superintendent Jenkins, I want to commend you and all of the members of the school board for taking decisive action and the courage that you have shown regardless of the preemption in terms of your authority. I believe in home rule, and I believe that you all are duly elected and you have the right to make the decisions that you feel are in the best interest of students and your staff. I'm concerned about any withholding, any funds that would be withheld and the impact that that would have on students. It's not about the salaries. You have a lot of responsibilities, and to what extent would withholding those funds hurt students is my question.
Thank you, Representative Thompson. I would answer that twofold. One, we do believe if the Judge Cooper's ruling, once it is in writing, and becomes a potential stay of those penalties, we believe that will settle all of those issues. And secondly, and probably more importantly, I know it's meant to be sort of a sign or a symbol that he's only withholding salaries from school board members at this point. Our board members certainly don't serve for the minuscule salaries that they receive. They receive typically around beginning teacher salary. Certainly that's not why they serve, but it's symbolic of trying, it seems to, of trying to humiliate board members who are exercising their responsibility for local rule. And so we've certainly had communication from the federal level, Secretary of Education Cardona, reinforcing the fact that should we have a need, those ESSER federal dollars can certainly be used for supplement. It's also, Representative Thompson, a bit odd to say at the same time, don't hurt students, but withhold dollars, because withholding any funds for an organization whose core mission is to educate our students can in effect be of some harm to students. And so it's a bit of an oxymoron in my opinion. Nevertheless, we feel confident with that federal backing that will be okay until such time that potential stay is in place.
Thank you so much.
So,
Go ahead, Senator Stewart.
thank you very much. I just think that it has been ridiculous for the state to refuse to stand down and insist that politics should be over the health of our kids. And I really applaud you and the school board for taking that necessary step to protect from the facts that have been provided to you from your health experts. And I think you've done the right thing. What I want to know is that as this continues, because it seems like nobody will stand back, what is it costing the school board to fight this demand over and over and over again?
We actually have in-house, our general counsel and deputy general counsel are actually in place, but we also have the need for some external expertise in order to deal with lawsuits, potential lawsuits, one that we were named in down in the courts in South Florida, in the Southern District. And so there'll be some investment for external counsel, but our internal general counsel and deputy general counsel have shouldered the majority of it. And I think probably what may go without saying, but resources that should be concentrating on more important critical issues around educating our students now have to be used or invested towards dealing with pandemic and lawsuits and judges' rulings. I will tell you, for example, our principals have done a yeoman's job. Our teachers are incredible, but principals having to deal with contact tracing support for the Department of Health and dealing with notifications on quarantines and hosting vaccine clinics, all of that just piles on to their normal day job, which is actually to educate our children. And so it is so easy to lose focus that we are drawing resources away from concentrating on educating our children and preparing them for their future. That is what is most unfortunate about all of this.
I have a quick question, Representative Goff Marshall. Thank you, Superintendent Jenkins, as everyone has stated about being bold with the mask mandate. I know you mentioned 65% of the employees with OCPS being vaccinated, and you're concerned with specifically with bus drivers. My question, is there a plan to see that number as close as possible to 100% with our employees with OCPS being vaccinated? Is there any type of push for that?
Absolutely.
Okay, and what kind of hurdles may you, or how could we help you with that?
Sure. So we use some of our federal grant dollars for that $200 incentive. We believe that incentive helped many of our employees go ahead and take that last step from hesitancy into action. For our bus drivers in particular, because they are not as readily connected to the internet, we have our compounds where the depots are actually helping serve those members of our employee team and helping them get online. Because I have to tell you too, our numbers are not based on someone actually needing to show their documentation of vaccination. Our numbers are based on those who have applied for to receive the incentive. And so we've partnered with Orange County Health and others. They're actually going to take some vaccines out to our depots where our bus drivers actually come in and get their buses every morning and offer the shots there. So we're hopeful that that will get our numbers up as well. And I think, I know there's quite a bit of conversation around mandatory vaccines, but anything that can be stated in support of vaccinations or of mandates would be helpful as well. We are taking it to our bargaining tables to see if we can't mandate it for our employees, but that remains to be seen.
Thank you.
I have a quick question too, if that's okay.
You're recognized, Rep. Escamani.
Thank you so much. Thank you so much, Dr. Jenkins. I just had 3 kind of related questions to what everyone has been sharing, and thank you to the school board for doing the right thing as well this past week. I know many parents that were grateful for that leadership. So I know that there's been, Representative McCurdy mentioned bus drivers, and I know there's been different stories around the state around like the lack of staffing support when it comes to educators, bus drivers, substitutes, and so forth. So I'd love for you to comment on just how are we doing when it comes to staffing, and it would funding to help increase salaries be the key to retain staff and recruit more staff? And with that question in mind, we've seen reports of federal money being held by the DeSantis administration for school districts to prepare for COVID-19. I'm curious if you've seen any of that federal money, and if not, what would you like to see? How can we help on that regard? And then I know part of the concerns parents have had too is the lack of a launch ed option compared to last year, because when students do have to be quarantined, I understand homework is sent with them, and like there's an effort to maintain the educational process, but of course not having a live stream can be a challenge to doing that. So I'm curious if any of the decisions from our school board would also create the launch ed option or something like that as well to continue managing through this pandemic.
Great questions, Representative Escamandi. Let me start with the first one. I absolutely, I'm so glad you brought this up. It would be extremely helpful for the legislature to provide dollars for pay raises that are not categorical. So this year, the dollar squeeze was so tight, we actually ended up probably because of the hold harmless, not probably, because of the hold harmless, fewer dollars to serve more students. Just a matter of an algorithm. However, the categorical dollars around beginning teacher pay really invest the majority of those dollars and gave us little flexibility on trying to help some of our lowest paid employees make a decent living wage and having some dollars set aside for recurring raises. What we'd love to have in the future are dollars available for raises that we can use for all of our employees. I think that is critical. I think also the governor used a portion of his federal dollars to send out $1,000 bonuses to principals and classroom teachers only. And our board used some of our non-recurring dollars, kind of break open the piggy bank, so to speak, and use your non-recurring dollars to make sure others also receive that $1,000 bonus, because everyone went through that pandemic to try to help serve our children, and our board agreed that was the right thing to do. So federal dollars remain to be seen what the governor may do with the remainder of his funds. We have a pretty good handle on how we will use our funds. But again, those dollars run out in 2023. And so you can't do pay raises out of those dollars, although some would argue, and some of our that it's like paying your mortgage out of your savings account. Savings account runs out and then you lose your house because it's a recurring cost. We've seen another district to our west suffer significantly because they were using non-recurring dollars for raises. It dries up very quickly. It would dry up in a couple of years. And so we use our dollars toward bonuses and incentives. And also for our teachers, we've used them for supplements. so that they can actually count toward their retirement. So we have to be creative in how we use those non-recurring dollars, but certainly grateful for them. And lastly, question of launch ed was prohibited by the State Department of Education. Certainly any inroads you might be able to provide there would be extremely helpful. In essence, if you try to provide that, it simply won't be funded at the full level. Everyone knows our actual virtual learning. Orange County Virtual School is funded about 27% lower than normal FTE. And so even if you increase those numbers, you would be hurting significantly. So it would be helpful to have that option. It was taken away. And I understand the Department of Education says for the majority of our students, that is not the best way for them to receive their education. We are at a loss then if we have to pivot a school back to digital learning or a grade level or a classroom. Then we have to say, and in Orange County, we have our Canvas platform anyway. We can say go on Canvas, but you're sort of on your own doing independent learning to look at your assignments and maybe look at some taped lessons and such. But we don't have synchronous learning. There's not live face-to-face learning with teachers this year. We've asked our teachers to consider voluntarily, if they are still in the classroom and some students are at home voluntarily, allowing the audio feed or the digital feed so that students can at least listen in and not be missing as much of their instruction. But for the entire pivot, it's either take-home packets and looking at 6 years we've been using our digital platform. They can look on their digital platform with their laptops and try to keep up with assignments that way. It's unfortunate that we don't have that option. It might be something that the delegation might consider.
Thank you, Dr. Jenkins. And last question I have too is I know that the last legislative session, there was a lot of conversation about missing students where folks did not know where they were, what they were enrolled in. I'm curious, just based on enrollment for this school year, what has been the shift in student enrollment? Are we seeing students, populations grow, populations decline, students moving to different counties, different options? I know it's kind of a bigger question. We can talk later about it too, but I'm curious what trends we've seen between this school year and last school year as well.
Sure, I'll make sure Scott and Jason have more details to provide to the delegation. Our enrollment has not made its projection at this point. We should be around 204,000, I believe, is what we were projected to have. We're short of that, just under 200,000 at this point. And we believe some of those students, as last year, we believe some of those families, because of the economic situation in Central Florida, returned home, wherever home was. We think a lot of our international students may have gone elsewhere. And during a pandemic, if mom and dad are unemployed, then they may have been sent to live with relatives where things were going to be more fruitful for their survival. And so I think we were supposed to be at 209. We're just under 200,000. We've seen a slight uptick in home schooling, those who want to instruct their children at home. We've seen a slight uptick in those choices, but we've not seen a huge increase in the number going to Orange County Virtual. In fact, it's less this year than it was last year. So time will tell. We have social workers and others engaged for any of our missing students. Probably have a clearer picture in the coming weeks on how many we're able to recover.
Quick question, Dr. Jenkins. I know that standardized testing scores were not counted against students last school year. What is your take? Are we thinking about that right now as to, or do we feel children would be prepared to have those scores count against them this school year, as they're trying to play catch up, and we just don't know. What is your take on that?
So that's an excellent question as well. All of your questions have been extremely insightful. We believe, number one, the board and I absolutely support accountability. We wanted test information from last year for one reason and one reason only, and that was to make sure we can diagnose where our children are. And so tests, information used for diagnosis, to inform instruction, and to help us fill in those gaps of a lost learning time absolutely are necessary. We appreciate it. The Department of Education did not issue grades unless you requested grades. And we did not request grades other than 4 schools who were actually coming out of the school improvement status because their grades went up significantly. Only those 4 grades did we request from the state, because it's a bit disingenuous to pretend that every school had a normal year. They did not. It was an unusual year. And so appreciate that hiatus on mandatory school grades for what happened last year. Your question to the point of what should be done this year is incredibly insightful, because we believe it is a year of trying to do some catch up and trying to do some turnaround and recover lost learning time. And so we would absolutely be in support of not having punitive measures be attached to the accountability testing outcomes this year as well. We're hopeful. It may be too much to ask, but we think this year of recovery would make sense not to have punitive measures attached to our state testing program and the accountability system.
Thank you, Dr. Jenkins. I actually had a question too. You had said that there was a 20% positivity rate, which is way higher than what we considered acceptable last year. What is the positivity rate that would cause the school to have to shut down and pivot? And what are the quarantine rules? I have a daughter in Orange County Public Schools, and we have gotten the call saying that someone in her class tested positive. We kept her home a couple of days knowing that the contact tracers are way behind. And it's an incredible burden on the schools to have to alert all the parents. I can't even imagine how difficult that is. Please give us a little update on that.
Sure. So Dr. Pino is next on your schedule. And so I would not dare try to explain all of the contact tracing and the actual strategies that they have to go through. I have to tell you, they've been incredible partners. We don't have an actual number, a cutoff, just like last year. We look in partnership with the Department of Health, Orange County, we look in partnership to say, can we still keep the school open? Do we have the adults in place to run the school? Is it going to be safe for children to still be in contact with each other? And that's in consultation. We don't have a cutoff number, an actual number that we reach that we automatically shut down. It's a consultation and a much more strenuous evaluation than that. And I will let people can certainly look on our website. We've got the flow charts, the decision tree around quarantine, but the Department of Health are our experts in that, while the principals have and provide seating charts and such for Department of Health. They do an incredible job of actually assisting us with providing quarantine information for our families.
Thank you, Dr. Jenkins, and I look forward to hearing from Dr. Pino on that. We should probably move on since we've had a great discussion with you. Our next person, before we get to Dr. Pino, is Kyle Shepard, who is the Director of Government Affairs, City of Orlando. Mr. Shepard, you are recognized.
Chair Goff Marcel, thank you for inviting the City of Orlando. Kyle Shepard, again, Director of Intergovernmental Relations for the City of Orlando, and I'm filling in this morning for Mayor Dyer, who's out on a well-earned vacation with his family. I want to try to hit on a few of the points that Representative Brown asked about in her letter. Just to start with, we of course don't ask our employees whether they are positive or not with COVID, and don't keep up with those numbers on a day-to-day basis. But our most recent numbers that we have based on self-reporting of our employees, the numbers are a little over a week old, is that we had about 45 employees self-report that they were positive with COVID or had been exposed and needed to quarantine because of exposure to someone with COVID. So out of a total workforce of about 3,200 employees, that's a manageable number, and our department directors will tell you that we've been able to maintain the level of service that our constituents expect across the board. In terms of the number of our employees that have received the vaccine, again, we have not required employees to divulge that information, but we have just recently conducted a survey, a voluntary survey, that was filled out by a number of our employees. In fact, a good percentage of our employees, and it showed some good news. Now, recognizing that self-reporting surveys and surveys that are voluntary have possible shortcomings. It's possible, for example, that people who are vaccinated are more likely to respond to such a survey. But putting aside those possible shortcomings, we have, as of right now, over 85% of our employees are reporting that they've received the vaccine. So that's a good number. On top of that, out of those that have not received the vaccine, a fair number have said that they intend to at some point or could be persuaded to at some point. So that's good news as well. So that 86% may actually go up. On top of that, one of the principal reasons that some of our employees who had not been vaccinated said that they had not been vaccinated was because the FDA had not provided final approval for some of the vaccines. Well, this survey was completed largely before last week's announcement that the Pfizer BioNTech vaccine had received full FDA approval. So that leaves us with more hope that that 86% number may go up, and we'll be in a position of helping Orange County fill up the orange. Now, in terms of what we're doing to encourage vaccinations amongst our employees, we have an incentive program, much like OCPS. So if you're an employee and you have been vaccinated or you get fully vaccinated before October 31st, we're offering a $150 bonus for full-time employees and a $75 bonus for part-time employees. On top of that, we're doing fun things like raffles for events, exciting events at the Amway Center and other venues of the city of Orlando. There are also additional paid leave benefits available if a spouse tests positive for COVID-19 or if an employee needs to take care of a child due to testing positive or having to quarantine. Those paid benefits are available to those that are vaccinated. On top of that, if you do require time off, if you are vaccinated, the city will provide additional paid time off for those who are vaccinated. So those things all together, we think, are providing a strong incentive and are why we're seeing a high level of vaccinations amongst our city employees. Now, in terms of employee protocols, like most organizations, we're following the CDC guidance and the guidance that we get from our partners at the Department of Health. So City Hall is open, our facilities are open, but in public areas, folks are asked to mask up, maintain social distancing. Our public hearings are hybrid now, both in front of City Council and in front of many of our citizen advisory boards, including our quasi-judicial boards. So you can appear and testify in front of those from home rather than have to come into City Hall. Finally, what we're doing to incentivize vaccinations community-wide. Our strategy and our principal goal since the very beginning of the pandemic has been to be a partner to our friends at the Department of Health, Orange County Department of Health in Orange County. So we've stood side by side with them when it comes to providing sites for mobile vaccination sites, standing up a vaccination site that is open 7 days a week from 9 a.m. to 5 p.m. at Camping World Stadium. And we're also partnering with Orange County at our mobile vaccination sites to do neat little incentives like raffles for events at different city facilities, such as the Amway Center, to encourage folks to get vaccinated. So that's a quick update from the city of Orlando. I'm happy to try to answer any questions you might have.
Any questions for Mr. Shepard?
I have a question, Chair.
Go ahead, Rep. Escamani.
Thank you so much. Thank you, Kyle, for all your work and especially just helping me be a better advocate for the city of Orlando as well. I wanted to touch on the local bill that we were able to get passed this past legislative session. What's been the impact of that local bill for some of our Main Street districts in the city? And then also maybe just some commentary on supporting small businesses. Obviously, the pandemic has been very difficult, especially for a lot of our restaurants and bars downtown. I've been connecting with some of our Main Street directors and other advocates to kind of see what we can do from a state perspective. I would love to hear any of your thoughts on some of the challenges economically for small businesses trying to continue to thrive throughout this pandemic?
Great question. And we at the city have a business development team that has been working hard to try to help small businesses, all businesses during the pandemic. And so we've done a number of things, whether it's relaxing zoning rules and a variety of other things to make it easier for businesses to provide services, say, out of doors as opposed to indoors, and a variety of other things like that. But I want to thank you and all the members of the delegation for your unanimous support of our local bill that we proposed last year. And what that local bill did was it made it easier for small restaurants in a number of our Main Street districts, including Mills 50, the Milk District, the Gateway Orlando Cimarron corridor, and others, to apply to the state for a beverage license. And we've had a great response so far. We know that as of last week, there are already 3 restaurants that are in the application process right now. We're on our small business team here at the city are helping them through that process to get them done as quickly as possible. But we anticipate many more restaurants over the next couple months that will start that process. And all of them have been very thankful about it and have said, hey, look, this is a wonderful way for us to increase revenue at a time that otherwise things are a bit tough. So we really appreciate that, that bill. And we will, as more restaurants come in and apply for that, and as soon as somebody gets their first license, we'll all let you know so you can stop by and enjoy a beverage at one of our small businesses.
Thank you, Mr. Shepard. Is there any other questions for Kyle Shepard?
Hi, Kyle. Representative McCurdy here. Since the city isn't requiring employees to be vaccinated, if we see in the next coming weeks or months, or probably based on Dr. Pino's advice, if we see, because the county is doing something different versus what the city is doing. If we see what the county is doing is working better, is there an opportunity to maybe adopt some of their best practices to encourage or mandate employees to be vaccinated with the city?
Thanks for that question, Representative McCurdy. At this point, we are not mandating vaccines of our employees, either of our non-union employees, and we also have not decided to sit down yet with our bargaining units to discuss that. But what I will tell you is, one, we are happy and pleased with the evidence that we have about the high level of vaccinations amongst our staff. So we're happy about that, and that has informed our decision in some part. But like with anything that has occurred over the last year and a half, this is a dynamic situation. And we look to our partners at the Department of Health, at Orange County, at the CDC for how to adapt to this dynamic situation. So there are always opportunities to rethink this in the future. But at this time, we've made the decision that we think our vaccination level is high enough not to make it a mandate citywide.
Thank you, Kyle Shepard, for the update. And now we will move on to Dr. Raul Pino, the director of the Florida Department of Health. Is he here? I'm not seeing him on the screen.
Good morning.
Oh.
Can you see me now?
I'm not seeing you, but I hear you. Go ahead. Go ahead, doctor.
He's in the conference room, Chairwoman.
I'm in the conference room. So, thank you for this opportunity to talk to all of you at once, which is a great feast for someone who needs support from the legislation. And thank you for your support through the state to our department. Of course, these activities, we will not be able to have done it without the collaboration of the county, our main partner, but also the city of Orlando. And of course, OCPS at this point is our greatest asset as a partner. So to give you an idea, in our county, we have diagnosed, with regard to the pandemic, 206,686 cases up to today, this morning. And of those, Florida residents were over 202,000. The number of deaths in our county is right now at 1,533, and we're about to report, is part of this number, an additional 34 deaths that occurred, that were reported since Thursday. Our incidence rate is in a better place than it was a couple of weeks ago, and we have described prior to these meetings that we were seeing some light at the end of the tunnel. The data was showing some recovery, and Dr. Xu spoke to you about that. But just to give you an idea, weeks, so you know, when I say week, this number is that in EPI, the CDC names the week by the number of the week during the calendar year, So week 32, we had our highest our incidence rate, and that was 634 people per 100,000. Just to give you an idea, a lowest point on week 24, just 10 weeks before that, was at 54 people, just 54 per 100,000. That's how much this increase happened in that last wave. And right now we extend at 544 per 100,000. So we have seen a small decline. And yesterday, the number of cases reported to us was 823 cases. Now, Sunday is not the best day for data in this case, but it has been the case that in the last few days, we have seen less cases than the day before. And that's, we are averaging about 1,000 cases a day. Another interesting thing that we have seen in the data is that it's moving to the youngest segment of the population, the age 5 to 14, at about 20 to 25 of all cases in any given day. And that is also reflected that in the last 2 weeks, week 33 and week 34, we have a negative growth in the total number of cases, and that is an indication that we have started to see some recovery. Another indication of a little bit of recovery is in positivity rate. Our positivity rate for the 14-day rolling average was at the highest as 20.5 on 8/18. Today, our positive rate is 17.8 for the 14 days average, and for the day is 14%. And another data that always lags behind, and that's the dichotomy of this data, is that in one side we have some good news. There has been a reduced number of visits to the ERs. It has been a reduce in the number of cases, total number of cases week by week, and it has been a decrease in positivity rate. Those are very positive data. But unfortunately, the number of deaths continue to increase and will continue to increase for maybe another week or two. Just to give you an idea, on June 21st was the June of this year was the lowest death count since we started vaccinations in January, and that was 31 deaths in June 2021. Now, July, we have an increase, and we went up to 58 deaths, so 27 more. And this month is not over yet, and we are at 107. So it has basically doubled since last month. And we should expect that that number will continue to increase a little bit as death report a little bit lagging on that. Another area that we have been very successful in our county and the health department is in vaccinations. Our county health department, with support from our county and EMS services, provide at the convention center alone more than 300,000 vaccines to our residents. Now, our county in total has offered 2,885,829 vaccines as of yesterday. That include 1.6 to residents and 1.1 million doses to non-residents. With regard to percentages with at least one dose, our county, for people who are 65, for all eligible population, that means 12 and older, we are at 66.8% vaccination rate with at least one dose. For the people who are 12 to 17, which we are following very close, as they are the only school-age children, K to 12 that is, that are eligible for vaccination, our rate has increased to 53.1% in that age group. And good news, for people 65 years and older, we are at 84.5% vaccination rate. We started to give in the third dose, the booster, as is known in the community, and we are giving about close to 400 boosters a day in any given day in the county. That's all the information that I have for you with regard to COVID-19. If you have any questions specifically with COVID-19, I can answer those now and then quickly move to our priorities for this year that we would like to get you support on it.
And I have a question.
Okay, who was the first one that said that? Who was that?
Senator Stewart.
Senator Stewart, please go ahead with your question.
I wasn't sure who hit the button first. Okay, I do thank you, Dr. Pino, and I know you have always some real challenging decisions that have to be made, and sometimes not the most friendly of atmospheres. So I want to thank you for hanging in there and helping our community. But I do want to know something regarding the recommended use of Regeneron and when should it be used?
So, the particulars of the product, I will leave it to a clinical person. Public health is not directly involved, but I can give you a general overview. So Regeneron is a good product that is on, it's an experimental treatment. That is how it's classified by the FDA. And it's a post-exposure treatment. So it's for someone that has been exposed or think that has been exposed to COVID-19. And the earlier that is given, the better, because it presents elevates immunity for a limited period of time and allow the person to respond quicker to the disease, recover faster, and decrease hospitalization and death rates.
And as a follow-up, is it given out at the request of an individual without a physician's request?
It can be given out, yes. Again, it's better responded by CDR McGuire and emergency management, who are really handling the site and are responsible for all protocols. But yes, people can walk in.
But do you think that the public may be confusing the use of Regeneron as a replacement to a vaccine?
Most definitely, there are people that think it's a substitute, yes.
And it's not?
No, and it will never be.
Thank you.
Rep. Smith had the next question. I see Senator Bracy is back on, so I'll pass the gavel on to him. Go ahead, Representative Smith.
Thank you, Chair Goff-Marcel, and thank you, Dr. Pino, for your leadership during a really challenging time. A question for you about data reporting and records. I know that you're aware that we submitted a records request to your office for critical public health data that, of course, was referred to the state, referred to Tallahassee. My question for you is around, I guess, current hospitalizations and particularly pediatric hospitalizations. Can you provide an update for us on how many children are currently hospitalized with COVID in Orange County? And if you can, where do you get that information from? Does that come directly from the hospitals? Or is that something that's still reported, I think, through the Merlin system that the hospitals use to report data, as opposed to the ESS system, which I know is typically only used, well, is only used during a state of emergency.
So Merlin is a system that the Department of Health has to report all infectious diseases. And yes, that data is sometime there. And I say sometime because the data is only as good as the data that is entered in the system. Now, right now, with regard to pediatric hospitalizations or adult hospitalizations, we don't have the health department or any health department at this point a reliable access to a centralized database like we did before. That has not been provided this time. We do have communication directly with the hospitals and keep our tabs on it, but it's more a non-centralized kind of anecdotal access to that information on the phone, how you're doing today, that kind of approach that is not the best as we had it before when ACA was providing a centralized data depository where we could find all this information at once.
Thank you, Dr. Pino. And a quick follow-up, thank you for that. Am I correct in understanding, based on what you said, that the data is there, it's just not easily accessible? Does the state, whether through ACA or the State Department of Health, do they have a daily reporting of COVID hospitalizations in the region that the data exists somewhere?
No, the data is submitted in a weekly report that is generated on Fridays by the State Health Department, and that's the only way that we have received data from the state directly. Although Orange County is a large health department that has the ability to conduct analytics at the same level that the state does, but again, we don't have access to centralized hospitalization data. Infection data, we can get it very reliable from Merlin, as you mentioned before.
Thank you. Any other questions?
I have a question.
We're going to go to Rep. Geraldine Thompson. Recognized.
Thank you, Chair. And thank you, Dr. Pino, for this update. I have a question with regard to the availability of ambulance service and EMT, which had really been strained because of the surge. Has that been addressed, and are people now able, if they need an ambulance or if they need the EMT, are they able to get that kind of service in a timely fashion?
So that's a question better for the county, as EMS is locally managed by the county. But I can tell you what they have described to us is that there has been some delay in ability to provide services, not because of the EMS has issues, although they probably have, a number of people infected and all the things that are impacting them. But the fact that it's not a bed in the ICUs and there's no beds in the emergency room, people have to stay inside the ambulance for longer time, having the inability to recycle the services back into operation rather quick.
Thank you.
I have a question. Oh, I'm sorry. Go ahead. I'll go next.
Thank you, Dr. Pino. I don't know if you heard my question before to Dr. Jenkins. She said you would be better able to answer it. But thank you so much for your work with Orange County Public Schools. And I know they had a 20% positivity rate. I was curious if there is a rate that would cause a school to have to pivot or the school to completely have to quarantine. And could you kind of explain to us more how these quarantine rules work? Because my daughter did receive a notice that someone in her class had tested positive, but we didn't receive anything else beyond that. Who gets the call that they need to quarantine? Please expand on that for me.
So on the ruling and the quarantine. So let me just give you an example right now. let's say that we are having an average of 1,000 cases a day. Each case, and that's positive cases, so that means isolation. Those people need to be isolated. Those 1,000 people need to be contacted, communicated with, email, phone calls, texting, all the techniques that we can use, and isolate those individuals. When you interview these individuals, they generate average about 4 to 6 contacts each, which is a little bit larger for kids. Now, in any given day, we have 1,000 cases, and I'm going low because, some days we have 1,500 cases. But let's take average. 1,000 cases, and then we have 6,000 contacts to trace in a day. That's not possible. It will require 3,000 people to be able to trace all those individuals at once. So what we have done is prioritize who are we tracking. Because the infection rate is such a high level right now that it's basically presence everywhere. And so it's safe to assume for anyone who is out there who wants to protect themselves at these levels that everyone can be transmitting the disease, even if they are vaccinated. That's the safest approach right now. Now, with that also, what is happening is that the state emergency rule, instead of giving us the 7 days that we have with the CDC for test out of quarantine or 10 days without testing, the state reduced it to the 5th day. So now we have less time to get people into quarantine before they come from quarantine. So if it takes out 2 days, 3 days to get to an individual with this number of cases, they are already coming back. In some cases when we get to them, because it's already the 4th day, and they are getting tested in the schools. Now, on specific your questions about your daughter, not everyone gets quarantined in a class environment, and that's why we have the cheating chart, because we are able to measure what is the distance between the source and the student if it was reported in the class. If we determine that your student or that kid, in this case your daughter, was more than 6 feet apart from the source, and there were masks used, or the source was masked, or your daughter was masked, or someone else was vaccinated, that changed the dynamics of who needs to be quarantined. Because it could be that it's reported that the class has a positive, but it was the teacher, for example, just an example, the teacher was masked, that daughter was sitting more than 6 feet from the teacher, that child will not get quarantined. Now, with regard with when it's safe not to operate the schools, that determination is done by the school. They manage the schools, they decide. Now, it is a little bit different because the schools in the past have the ability to pivot people into remote learning rather quick. But in my experience in the past with the school board, what determined the most, the pivoting or closing of an environment, was how many teachers they have present to be able to offer education for adults to keep the school as a safe environment, more than the number of students that they were either quarantined or isolated. Now, a high percentage of the teachers and other adults has been vaccinated, so I assuming that our collective needs to close and pivot is going to be a little bit smaller than it was in the past. Another element that we have to keep in mind is that the school started mandated masks today. So it's safe to assume that by Friday or Monday, we will see a decrease in the number of cases in that school population age 5 to 14, which will see an increase of the number of cases that they represent in the total percentage of the pandemic. Now, that ruling also gives us the ability, we are going to reduce the quarantine from 6 to 3 feet if we know that everyone in the classroom is mask. If we have the ability to know that everyone in the classroom was masked, we will move that quarantine from 6 feet to 3 feet. We have done it in the past, and it's safe to do with mask. There are several studies, one especially out of UCF, that indicate that with good mask, after 2 feet, you have no droplets.
Thank you. I'm going to take one more question by Representative McCurdy. I want to make sure we get through our morning agenda. So I'll take Representative McCurdy's question, and we'll move to the next speaker.
Thank you, Chair. Thank you, Chair Bracy. Dr. Pino, good morning. I know you said that with the mask mandate for schools that started today, we should see a decrease in the number of cases in about a week or so. It seems like every time we get a handle on this thing, something like a holiday pops up. So I'm thinking about Labor Day, that's a week away from today. Are we prepared for possible uptick in cases? I know the mask in schools, but you got to think about folks celebrating a holiday coming back. What's the messaging? What should the messaging be this week for our constituents? And are we prepared at the Orange County Health Department for a possible upticking in cases?
You are absolutely correct, Representative. We should see a blip. The increase of cases related to holidays, although it happened, it does happen. We can see it in the data. It doesn't seem to be as constant and permanent than other social activity that are more constant, because you have an increase on holiday activity, and then people go back to normal 2 days. So the time the time that people are exposed to this environment plays a role in transmission, of course. So we have seen blink, but they are not lasting from the holidays. The lasting environment that we have seen is when we increase social activity for a longer period of time. Now, there is interesting national data with cell phone activities and how it correlates to infection, the mobility of the people. And it's quite interesting, the data that is out there. How can you predict by cell phone activity what is going to happen with the pandemic? This is driven by social activity, interaction, and how close we get to each other. And any environment that favors that, we will see an increase.
Thank you, Dr. Pino. We appreciate your expertise on this matter. We're going to ask the Honorable Tiffany. Go ahead.
No, I have a quick, to give you my priorities for this year. They are very quick, but I wanted to put it in the front for you. Of course, COVID-19 and continue to fight it. We have the resources that we need. Finding employees and training employees is the issue for this type of environment. We also are expressing the need for our health department to have a building, a central structure. We are putting a proposal together. It will be with the state. If any of our members would like to have a project member for this year, or collectively you would like to do it, I think Orange County contribute enough to the economy that our residents should have a facility that they are deserving of. We are very spread around the county in 13, 14 locations, and it makes it very difficult to offer comprehensive services to storefronts and other places that we rent when we are offering clinical services. And on HIV, that's the next pandemic that we want to fight, and we continue to fight. And on the pandemic, another thing that I think will help us from the structural point of view, legal, is the decriminalization of HIV transmission that continues to be a case in Florida. That's arcade, and it doesn't contribute to disclosure and to be able to fight the pandemic. And another thing that is a priority for us is newborn HIV cases. Florida and Central Florida continue to have newborn HIV cases. That is not the case. The first fight for the pandemic is to eliminate newborn cases. Other states have done it. The only thing that we have to do is to mandate HIV testing at the time of delivery if it's not resolved in the clinical chart. And that will take care of new infection in newborns. Thank you, guys.
Thank you. Dr. Pino, how much is that appropriation request for that facility?
What was that, sir?
The facility that you are asking funding for, how much were you going to be asking for?
The total facility will be between $40 to $50 million. It includes a parking garage that will be used by the stadium when we are not in work, which is normally when they have games on nights and weekends. And we have clearance from the county and the city of Orlando that we can build in the Paramount area where we are currently located, one of our locations, or next to it, and we think that is significant to be in a centralized community. We also serve everyone around us, not only Orange County, so that's an important element to put out there.
Got it. Thank you. And do you have any matching funds for that outside of the state request?
No, sir. The way that is a structure for us, the state has to provide the funds. The county will own the building. It will not be owned by the state. There are some regulation in place how this has to be done, and that's the process that we are planning to complete by December. So when you come in session, if you wish, you could choose to support the project and move it forward.
Got it. Thank you so much, Dr. Pino. I appreciate it. I'm sure members will consider sponsoring.
Thank you, sir.
All right. We're going to move to Honorable Tiffany Moore Russell, Clerk of Courts. Good to see you, Madam Clerk. You're recognized.
And members of the delegation, I do have a PowerPoint, so I'm going to rely on Mr. Boyce over in the county building to upload that presentation.
We're uploading it momentarily.
Thank you. So there it is. So while we are uploading it, I will, so we were asked to provide you with a COVID-19 update when it regards to the Orange County Clerk of Courts office. And part of my update is also going to address evictions. I know many of our delegations here locally has always been very interested in the eviction issues that's happening. So next slide, please. So here I have for you yearly case totals for eviction case filings that date all the way back to 2009. And this, I want to give you a historical perspective just to be able to compare the difference of pre-pandemic to where we are today. And I do want to bring to your attention that the eviction process is a case type and it involves multiple agencies. The clerk of court is the receiver of the filings, and we all know our judiciary, which you'll hear from our chief judge later, is the presider. And then we also, evictions involves law enforcement. I mean, that's the sheriff's office when they serve the writ of possession and if they have to remove someone from their home. So as you can see from the chart, we normally, pre-pandemic, was in the almost 10 to 11,000 annually when it comes to eviction filings. As you can see from 2020 and 2021, we have been less than 7,000 for the past 2 years. And as of August, you can see it was refreshed. We're at 5,200. And so I do want to acknowledge the efforts of the city of Orlando and Orange County government, because even during the moratorium, the emergency rental assistance programs that provided assistance to landlords and tenants, I do believe have played a part in the reduction or the lower number of filings here. And I know some of you may ask, well, we were in a moratorium, why were there still eviction filings? It's because we still had to receive the filing. It does not mean that they move through the process. It's just we have to track what was actually filed in the e-portal system. So I just want to alert that to you why we still have those numbers. So like I said, anyone can file, but now that the moratorium has been lifted, we will now start processing and moving forward. If there was a writ of possession or a final judgment issue, but it was paused because of the moratorium, it will now move forward, as well as any other eviction case filings. And so based on that, we will address our resources if we see an increase in work that we would need to address those cases. So that's when it comes to evictions. Next slide, please. So as I said, preparing for future filings, right now we don't see an increase currently, but if an increase does occur, we will shift resources to ensure cases are processed in a timely manner, and we constantly monitor our workload. The manager over civil also works really well with our administrative judge that oversees the judiciary that manages those cases. So we're constantly providing updates to the judiciary as far as volume and making sure that we can be timely and respond to the demand or the increase in workload. Next slide. Now, although, as I mentioned, I'm the receiver of the file, one of the things that we do try to do is provide assistance and direct customers for resources. So you've all heard me report in the past on the Self-Help Center. Again, we are now going to be open starting soon, 4 days a week, where people can receive consultations with the Orange County Bar Association to assist their residential eviction responses. We do have a legal forum coming up on Thursday, September the 9th, to address post-moratorium evictions. And that's going to include someone from the judiciary, as well as an attorney and law enforcement to help residents understand how to interact with law enforcement if a writ of possession is delivered or served to their home. So again, we will share that information to each and every one of you so that you can share with your constituents. So again, our effort is to make sure that citizens are knowledgeable and know how to navigate and interact with their judicial system. Next slide. So just briefly to share with you how the COVID surge has impacted the clerk's office. And of course, the surge dates from July 1 to 8/20. So within Orange County Clerk's office, we've had 15 positive COVID cases. That's about a 3.8% of our workforce. About 28 employees have missed work. And that's either due to testing positive, close contact, or caring for a family member. And unfortunately for us, which was very devastating, we lost one member of our team due to COVID. So, and that was a very heart-wrenching journey for our office and the individual and all those who worked alongside them. So that is an update as far as what has happened in our office when it comes to COVID-19. Next slide. Just to share with you some of our proactive steps, and you all, I think you'll hear from Judge Munyon. The clerk's office takes a lot of direction from the Florida Supreme Court because we are in the courthouse. And so we must follow any directive or administrative order that comes out with how we must conduct ourselves in the courthouse. So we have reactivated our face mask policy even within our offices. So we're not talking about facing the public interaction, but more in my back office. We've reactivated our face mask policy. We have partnered with Orange County on the I Got My Shot mobile vaccination unit, and we have brought them to the courthouse. And we actually listed the dates for you where we had the mobile unit at the downtown courthouse and actually at our Ocoee branch. So we have been very proactive in trying to bring vaccinations to our employees so they're not taking a lot of time off from work. We communicate bi-weekly with our staff based on Orange County's positivity rates. We provide them information at vaccination centers throughout the county, as well as testing sites, and continuing to remind them on CDC recommendations. We do follow the exposure and return to work protocols. And along with the courts, we have limited public access to the court facilities. And so you may say, what does that mean, limit? So I'm gonna give an example, and I'm gonna use Representative McCurdy. Representative McCurdy needs to come to the Self-Help Center. Only Representative McCurdy can come into the courthouse, not Representative Curdy, his staff, and his daughter. They have to stay home. They cannot come with him. That's what we mean when we say limiting public access to court facilities. You cannot bring others with you when you come to conduct your business in the courthouse. And that is to limit the number of people walking through the courthouse and conducting business and interacting with our staff. So we're just trying to keep it limited to those who actually have to be here. Next slide. So any questions about my COVID update before I go into my legislative priorities? No? Right.
I have a question, Chair Bracey, if that's okay.
Yes, go ahead.
Thank you so much. Thank you so much, the Honorable Clerk of Court. We really appreciate everything you are doing. And of course, it's been a difficult year just navigating some of the financial ups and downs too. I wanted to ask specifically about rental assistance. I'm curious, just watching the eviction process in the courts from your perspective, how many of our tenants that are still facing an eviction have applied for rental assistance but are just waiting for funds to be dispersed? And also, has there been a conversation about integrating into the courtroom someone who can also lift up rental assistance as an option to divert from an eviction? I know in Osceola County, there's been efforts made so that in the courtroom, there is a voice that can say, this person is eligible for rental assistance, this person apply for rental assistance to try to get that money to them first before they face an eviction. So I'm curious, what efforts have been made here in Orange County.
Thank you, Representative Escamani. I am not familiar as far as how many dollars have been expended from the rental assistance program. I would refer that question to Orange County government, who were the receiver of those dollars and the distributor of those dollars. I know from my office, if they were referred to us, we referred them quickly to the diversion program. I know the county's program that was started a year ago was meant to avoid even getting an eviction filing, because we all know once the filing has occurred, it's now that is not expunged. That is part of their record. So I know the county's intent behind their diversion program was not to even be a case filing, to avoid having to go through the eviction process. But I would, I don't know if Mayor Demings had someone coming before you, but they would have those numbers as far as how much has been spent, how many residents have been served through that program. I know I have not had a conversation with the chief judge as far as how it would be handled from the bench. Again, I would save that question for Judge Munyon as well, because that would be a judiciary discretion, how they would handle once the tenant and the landlord is in front of them. We try to be the navigator of resources, referring them to the Orange County Bar Association, what programs are available, if they once they've been served an eviction complaint. So, so it just depends on how the judiciary wants to handle that part. But we're always open. We worked well with the county in implementing the diversion program last year. And so we're always open to working with our judiciary as well as the county to continue any further efforts, of course, to reduce, because we know what the impact it has on families once you have an eviction on your record.
Thank you. I'll go ahead with your legislative priorities.
All right, thank you, Chair Bracy. And first, I want to thank you all. Give a sincere thank you to your support last session of Senate Bill 838, which was the Clerk Stabilization Bill. And you all remember this bill authorized clerks to establish and maintain statewide reserves in the Clerk of Courts Trust Fund, and it codifies and makes permanent carry forward authority that was due to sunset in June 2022. So special acknowledgments to Senator Bracy, Senator Torres, Representative Brown, and Representative Morales for co-sponsoring the legislative priority, and all of you who voted for that legislation. I say thank you. And so we're excited to begin the overhaul of our broken model and diversify our revenue sources to continue providing essential services to the citizens of Orange County. And the signing of our stabilization bill was a very important first step forward for the clerks to establish this framework for future long-term solutions. I also am extremely thankful for your support of the emergency funding for the pandemic recovery plan for clerks. So the legislature, thank you very much, allocated $6.25 million statewide to assist clerks with our essential support services to support our court system for the backlog of cases due to COVID-19. So looking ahead, there is more to be done. As I mentioned, Senate Bill 838 was just phase one of trying to address our funding problem. And so first we need to continue to work on our revenue structure and how our services are funded. So as just a reminder, I know I've come to many of you in the past that clerks are funded based on the Constitution, and it can only be funded primarily through fines, fees, and court costs collected each month. So from the model right now primarily depends on civil traffic citations to fund many of our other areas, such as our no filing type cases, and that's domestic violence injunctions, criminal case work, which is typically our high cost, high workload divisions. So this structure was set up many years ago for traffic citations when they were a low cost, high volume funding mechanism, but that's not the case anymore. This source has become increasingly unstable. Those resources are no longer available to support the no fee services we provide. So this unfortunately has collapsed our budget, while we need to continue to provide very important services. So this year, our aim is to evaluate how existing revenues are distributed and diversify them through our reliance on civil cases. So we do plan to bring forward solutions that will help reduce driver's license suspensions. I know many of you, I have worked with you for years. Representative Thompson, Senator Bracy, for years we've talked about driver license suspension. So the clerks are going to be proactive with a proposal coming to you. We don't want to be reactive or responding to legislation. We are actually going to bring proposals to you so that we can come and help you come up with a solution that will be successful. So our association is currently drafting legislation that will look at bringing some type of proposal to you shortly. And so I will be coming to you personally and individually talk about those upcoming proposals. Another important proposal that I will be bringing forth to you is to look at Florida Statute 28.2412E, which is I'm requesting a service charge increase to the Public Records Modernization Trust Fund. As many of you all know, the pandemic has brought to light the high need for technology when it comes to operating our court system. When we had to move to virtual, our trial clerks were having to get on video cameras. We all know our courts had to do a lot of video using Zoom, Microsoft Teams, WebEx to conduct hearings. But that trust fund, which is meant to fund technology, is not currently funding the needs for the clerk's office as well as the court system. And so for 16 years, this funding has not increased. And we've done a personal study for Orange County to see what will happen. And by 2026, we will actually run out of money based on our predictions compared to the cost of technology today and the increasing demand on technology. So I will be coming to you in the future to talk about the clerk's bill when it comes to looking at driver's license suspension proposals, as well as some other funding initiatives, as well as looking at the Revenue Trust Fund that deals with technology. So I will be in Tallahassee November the 2nd and 3rd for Clerk's Day at the Capitol. So I hope to be able to spend some time with each and every one of you. And I look forward to your continued support of the Clerk's 2022 legislative priorities. Thank you all so much, and I wish you much success in your upcoming session.
Thank you, Madam Clerk. Are there any other questions about the clerk's priorities?
Representative Thompson has her hand.
Go ahead, Representative Thompson.
And thank you, Madam Clerk. My question has to do with the initiative on the part of the Clerks Association to establish a database for returning citizens so that those individuals would be able to go to one central clearinghouse to determine what fines and fees, what legal obligations they might have. Can you give me an update on that?
So currently, are you talking about the data transparency legislation that was passed a couple years ago with FDLE?
Well, I'm not sure when, but there were discussions last session about the need for a database for returning citizens, and that this is something that the clerks throughout the state were working on.
Okay, so that I think they're referring to, yeah, that's the legislation, I can't remember, a couple years ago, but it's called the Criminal Data Transparency Bill. And so we're currently working with what they call the schematics, the rules, the framework of what that will look like to be able to communicate with FDLE. So we're still currently in the drafting or design of what that technology or that software will look like to be able to share information. But it has, we have not gone into testing yet for that, Representative. But I can always keep you an update.
Thank you so much.
Any other questions? All right, Madam Clerk, thank you for coming on, and we look forward to seeing you in Tallahassee and hearing your proposals and your ideas about how we can continue to support the clerk's office, yours in particular, but also statewide. So we appreciate your partnership.
All right, thank you all so much and have a great rest of your day.
All right, thank you. All right, we'll move on to our elected officials portion. Yes, we will now receive remarks from some of our local elected officials and spokespersons for government-related entities. Each speaker will have 3 minutes to address the delegation. A timer will keep track of the time, and we will let you know when your time has expired. Members, if you have questions, you will have an opportunity following each presentation. Please remember we have other speakers to follow, and I'm sure each speaker will be happy to supply further information to your offices electronically following the meeting. And just remember, we have a noon deadline that we're trying to meet to adjourn for the morning. So I think it's 11:30 now. So we're going to quickly move through these. But first up, we have the Honorable Brian Nelson, followed by the Honorable Lisa Munyon, then the Honorable Marty Sullivan, and then the Honorable Rosemary Wilson. Mayor Nelson, please state your name and address for the record. You are recognized. I don't know if he needs to give his address, but.
right. Well, thank you. Thank you, Chairman Bracy and the Orange County delegation. Just a couple quick things. I won't try to hold you up. I'll send you some supporting documentation later on in the week. Just one big funding request. We've had an issue at the Seminole County, Orange County, Apopka border with Border Lake and Lake Cortez. We've had some flooding. And so we've got a couple of alternatives to fix that flooding. Neither of the options are inexpensive. One would be a drainage well replacement. The other one would be just to pipe all of that excess stormwater to our plant out on Cleveland, and then where we would treat it and use it for reclaimed water for irrigation. So that will be coming forward. We'll have some additional details for the delegation as we move forward. The second item, just wanted to bring to your attention, it's not a state issue, but it's a federal issue, but it's just something for you to at least think about. Under the American Rescue Act, there's monies that were allocated to cities, either as a metro city, which we are now just barely included as one because we hit the 50,000 mark. And then there's the non-entitlement units for the cities under 50,000. And so our allocation from the federal government, because we are a metro city, was just north of $7 million. But you take, for example, Winter Park or Ocoee, our sister city of Ocoee has 48,000 people, and they're getting $24 million. So we're getting 7 million, and a city slightly smaller than that than we are, but because they're in that non-entitlement unit, they got $24 million. So there's a real discrepancy in how some of the smaller metropolitan cities, St. Cloud be another example, that in kind of the same boat that we're in, they're getting about $8 million, and yet they're barely over the 50,000 threshold as well. I don't know if there's a solution for it, but I did want to bring it to your attention. And what's even interesting on top of that, if you take the larger metropolitan cities like Fort Lauderdale or Orlando, even they got more money per citizen than we did. So none of the numbers make sense for us small metro cities, from the 50 to the 75,000 population cities. So I just wanted to bring that to your attention. We've also reached out to Congresswoman Demings, Senator Scott, and Senator Rubio, just to let them know that we think we got the short end of the stick, and is there any way to fix that? So with that, appreciate you all that you guys do and gals in Tallahassee, and we look forward to seeing you hopefully this year.
Thank you, Mayor, and I appreciate you bringing that issue up. I'll be taking a look at that. Anyone else have a question for Mayor Nelson? All right, thank you for being on, Mayor Nelson. Good to see you.
Thank you.
All right, we'll have the Honorable Chief Judge Lisa Munyon, 9th Judicial Circuit Court of Florida. You are recognized.
Bracy, senators and representatives, thank you for supporting our courts. I don't have any request of you today. I just wanted to introduce myself and offer to help you in any way that I can. I know many times during the legislative session, questions will arise about the courts or about your local courts. I know that OSCA is great at answering those questions, but you may need some more specific information related to the Ninth Circuit. Please feel free to reach out to me. I'll make sure that your staff has my contact information as well as my cell phone. I also wanted to let you know that for the past 10 years, I've been the chair of the Florida Courts Technology Commission, which sets technology policy for the branch. And I'm presently chair of the Supreme Court's COVID-19 Continuity Work Group. So if you have any questions with regard to either court technology or our COVID response, please feel free to reach out. I likely can answer your question, and if I can't, I know people that can, and I will get your question answered. So with that was all I wanted to tell you, is that I'm here to help you. I thank you for all that you do for our courts. I'm sure that we will have some asks of you at some point, but today I don't have it.
Well, thank you, Judge Munyon, and it's good to see you, meet you. Are there any other questions for Judge Munyon? Yes, Representative Escamani first, and then we'll go to Representative Thompson. You're recognized.
Thank you so much, Chair Bracey, and thank you so much, Judge. It's great to meet you virtually. I would love to talk more offline, specifically about eviction diversion and just what steps that we can continue to take with our courts and trying to slow down, which is the tsunami of evictions that many tenants are facing now that the CDC moratorium has been officially concluded by higher court. So I look forward to being able to talk to you hopefully sometime this week, since the situation is super urgent, and love to hear some of your insight to other steps we can take to get rental assistance dollars out to people and see how that can be leveraged to prevent an eviction so that the landlord is made full again and the tenant doesn't have that eviction on their record.
Well, thank you. I look forward to that conversation. And I will tell you that as a court system, we've done what we can to get information out about the diversion programs, both in Orange and Osceola County and in the cities. We put that information on our websites and we refer people to that information. In Osceola County, we partnered with the clerk. The clerk is going to have someone from Osceola County's diversion program available in the office to give information to both homeowners and to tenants so that they can get funding if they qualify. I will tell you, Osceola County's model is different than Orange County's model, and Osceola County filings have to occur first, which is why it makes sense to have them in the clerk's office to immediately after the filing direct them to the resources. In Orange County, the goal has been, rightfully so, to keep them out of the court system altogether. So, we're trying to provide as much information as we can, but we don't know the population of people that may benefit from the diversion program.
Representative Thompson.
Thank you, Chair Bracey, and it's good to see you, Judge Munyon. Given that there will be evictions now that the moratorium has ended, do you anticipate requesting additional judges for the Ninth Judicial Circuit?
The Supreme Court certification opinion has not yet been released, but I have seen some data with regard to our workload. And while we are very close in the Ninth Circuit to qualifying for new county judges and circuit judges and county judges in both Orange and Osceola, we are not at the point at this stage that we could justify an additional judge based upon the number of filings. The difficulty is 2020 and 2021 have been anomalies, and I think it's very difficult to look at the 2020 and 2021 numbers and come up with a good idea of how busy the courts are. So I'm looking forward to post-pandemic numbers to see where we truly are in filings and dispositions.
Thank you.
Thank you. Representative Smith, you had a question?
Thank you, Bracey. Actually, was going to ask a similar question or try to continue the dialogue like Rep. Escamani was talking about with evictions. I get how the Osceola County government appointed person that is there to help those who are going through the process of unfortunately being evicted. Are they virtually present in your court hearings, or is their office just available? Like what is their interaction with these cases as they're proceeding?
They are not actually in the court hearings. They are available in the clerk's office. I believe they actually have a physical office in the clerk's office to intercept those people that have just filed evictions to try to get them into the program. The goal is to keep them from having to go to court because we divert them into one of these programs that has resources.
Great. Thank you so much, Chief Judge Munyon. We look forward to hearing from you, and I know a couple of representatives wanted to connect with you. So we look forward to the continuing communication. Next, we will have the Honorable Marty Sullivan, Commissioner of the City of Winter Park. Honorable Sullivan, you are recognized.
Bracy. I'm Marty Sullivan. I serve as Commissioner for the City of Winter Park. By way of introduction, I've been in Florida since 1947. Thank you for taking the time to allow me to share with you a priority I believe is of importance to our city and throughout the state. I worked with the Florida League of Cities, establishing a set of policies and priorities for our cities and for the state of Florida. I worked with Jeff Branch, the Florida League of Cities legislative advocate, on this particular item I want to bring forward. Transportation is a priority of particular interest for our city and for the Florida League of Cities. Our region is booming in Central Florida with surging transportation demands. I ask for your help to move us forward with innovative, sustainable, and equitable means. We need positive impacts on transportation. We need to improve our quality of life and our environment. Our Winter Park Comprehensive Plan sets target levels of service priorities for transportation. First of our priorities is pedestrian and bicycle infrastructure. Next is transit. The last priority is private vehicles. We need innovation and funding to meet this lofty goal. We and other municipalities lack options to increase revenue to meet these goals. We struggle to fund local transportation projects, while charter counties may impose up to a 1% sales tax for transportation infrastructure. However, we, the municipalities, need increased and alternative funding sources from the state level. A sustainable future includes electric vehicles. We believe the state needs to support charging infrastructure for electric vehicles. In addition, the state should incentivize local governments. We need electric conversion of government vehicles. This includes government vehicles for transit, as well as the fleets of city, county, and state. In summary, I ask that first, FDOT establish a grant program for vehicle charging infrastructure, both public and private. Also, FDOT provide technical assistance in furthering this goal. Lastly, we ask that you, the legislature, enact funding mechanisms for municipalities. Our current and future transportation needs require funds for infrastructure and for innovation. Thank you.
Thank you, Marty Sullivan. Any questions? Yes, Senator Stewart. Recognized.
Commissioner Sullivan, I wanted you to know that I agree with most everything you've said here thus far, and that I am working on some legislation for enhancement for electric vehicles and a number of other things that you have mentioned. Probably not all of them. That's a big ask, but there are things that we can do, I think, in the next coming up legislative session that we can get a buy-in. And also, just to let you know that my discussion with Mayor Demings also had requested similar sort of legislative moving forward requests. So we're working on that. If you want to put a list of your things that you just announced together, we'll see what we can do. But and others here might be willing to pick up on a few of those. But I know my staff is definitely working on electric vehicle assessment.
Thank you so much, Senator Stewart. Let me just mention one reason why, of all of the issues that come forward, I chose this, is I believe it can be approached as a bipartisan issue. There are many things that I would like to see go forward that might not be, but this one I believe is.
Yes. Well, thank you, Commissioner Sullivan. And I've been thinking about electric vehicles also and the infrastructure to be put in place as we try to ease traffic concerns and just get our economy ready for the future. I think that is a part of it, making sure we have the infrastructure for electric vehicles. And so I appreciate you bringing it up. Senator Stewart and I have been having conversations about that. So your concerns are heard. So thank you for being on, and we'll move on. Thank you so much. We're going to go to the Commissioner of the City of Ocoee, Commissioner Rosemary Wilson.
Good morning, Senator Bracy. Hey, Senator Bracy, this is Joseph McMullen from the town of Oakland, Commissioner of the town of Oakland. I'm representing the Tri-County League of Cities. The reason I'm here this morning is because Rosemary if the meeting was going to be live, Rosemary was going to fill in for me. But seeing that we went to the virtual format, I was able to step in. And so, hello, good morning, delegation. Again, my name is Joseph McMullen. I'm the commissioner from the town of Oakland. And I talked to Senator Bracy on the side when he didn't mention the town of Oakland and the areas he covered. So we'll talk about that on a sidebar. But seriously, I'm the commissioner of the town of Oakland. I'm also so thank you to the delegation for allowing this time. I'm also the president of the Tri-County League of Cities. So going along with the same message that Commissioner Sullivan just gave, I'm going to share with you some additional legislative priorities that has been adopted by the local and the state level Florida League of Cities for our 2022 sessions. Of course, I'm not going to go into all of them, but I just want to give you a brief overview. Now, before I go over them, my goal and my wish and my desire is that everything that we discuss or we try to work with on a local level has, is a linear type of relationship from local to county, state, of course, and federal. And hopefully we can have some synergy on the items that we're going to discuss. I was glad, and I've been doing this for a long time. And my good friend, Representative Thompson, who's been such an instrumental person for the area in so many different levels, mentioned home rule this morning. So, on the Florida League of Cities level and Tri-County League level, we always talk about home rule. And what you're going to hear coming up in this new session from the local electeds, local voices making local choices. In addition to that, you probably saw this already last year, a lot of advocacy. Of course, COVID kind of changed how we interact with the legislators. So, advocacy was real big as far as the Florida League. Commissioner Tony Ortiz is the immediate past president, so he started that last year. Now, the current president is Philip Walker out of Lakeland. So you're going to see a lot of us, on a local level throughout all the 411 cities, really come alongside you and hope we can have this linear synergy and this home rule discussion on a regular basis. So with that being said, I will leave off. I'm glad Commissioner Sullivan mentioned the transportation, so I will leave that one off. And I'm just going to give you just an overview of just some quick snippets of all of the priorities that we mentioned. And I will say to Senator Stewart, we will have all this as a working document for you. Our meeting, our annual conference just ended mid-August, and so all this that I'm sharing with you is off the presses, and you will see all this information given to you. So one area, communication service tax reform. reforming the communication service tax in a manner that is revenue neutral, provides for a broad and equitable tax base, provides for enhanced stability and reliability of an important revenue source for municipalities. Short-term rentals, restore the authority to local governments for the regulation of short-term rental properties as necessary for quality of life, public safety, and a fair lodging marketplace. I was the vice chair of the Economic Development and Land Use Committee, and I even had some discussions with Kyle from Orlando during the conference. Did some quick discussions. So with this priority, legislation and policies that encourage coordination among Enterprise Florida, Department of Economic Opportunities, and other state agencies and state agencies and cities to promote local economic development by providing increased funding, technical assistance, and increased collaboration between the cities and states and cities. I will give you just one note. You know, the state of Texas is the only state in the union that every city and town has an economic development department. I want that to sink in. I don't care what city or state in the huge state of Texas, all of them have an economic development department. And it will be great if we could do something of that nature. And then last, I want to leave you with affordable housing. And I know this delegation is really, concerned about this. So the Florida City supports legislation that require all monies from the Sadowski Fund, State and Local Housing Trust Fund be used only for Florida affordable house programs, targeted to meet the needs of the workforce housing, including low income, very low income, and disabled persons for both home ownership and rental units. You may hear us say workforce housing or affordable housing, but we're asking that this be something that we all can work together. But again, I'll leave you with this: local voices making local choices. Help us come alongside you so home rule can be something that we all can understand that we want to work together. And if we can have a linear relationship between our local elected officials, county, state, and federal. As the president of the Tri-County League of Cities, that's my goal for us to work closer with all of our elected officials on all levels. I thank you for your time this morning, and I look forward to meeting with you throughout this special session and in 2022. Thank you very much.
Thank you, Commissioner. Thank you, Commissioner McMullen. I don't know how I forgot Oakland in my comments, because Oakland is extremely important to me, right down the street from where I live, and you all are so important to this region. So please excuse my oversight. But thank you. It's always good to see you, and we appreciate the partnership with the City of Oakland, and specifically you. So thanks for being on. We're gonna move to Dr. Plinsky, with the president of Valencia College. Dr. Plinsky, you are recognized.
Thank you so much, and good morning. My name is Kathleen Plinsky, and I am completing my second month as president at Valencia College. I'm not new to Valencia. I've served at Valencia now for 11 years, first as the president of the Osceola, Lake Nona, and Point Siena campuses, and more recently as executive vice president and provost for the district. I feel so fortunate to have the opportunity to serve in this role and to call Central Florida my home. I would be remiss if I did not begin by thanking you and your staffs for always being supportive and available to us. We greatly appreciate your partnership. We continue to navigate through the pandemic. In spring of 2020, we converted more than 4,000 of our classes to the online environment within a week. We also called every one of our students who were enrolled to check on them and connect them with the resources that they might need. Over time, we have learned that 1 in 5 of our students has contracted COVID themselves, and 1 in 3 had someone in their household who was infected. A third of our students lost their jobs during the pandemic, 60% had their hours reduced at work, and 40% experienced food insecurity so severe that they were unable to purchase food due to financial reasons. This fall, we are now offering about 30% of our classes on campus. We made the decision early to commit to smaller class sizes to accommodate physical distancing. We invested approximately $20 million of our federal rescue funds to hire more than 270 full-time visiting professors to allow us to offer more classes to keep our average class size on campus at about 10 students. As you look ahead to the future of our state, I wanted to briefly share with you my vision and our plans for Valencia. At Valencia, we believe that anyone can learn anything under the right conditions. Our Board of Trustees have approved a strategic impact plan with bold and ambitious goals for access, graduation, transfer success, and the workforce. Each of these goals will be measured through a lens of equity, meaning that any differences that we see in terms of who is going to college or levels of success when we disaggregate by race or ethnicity is a signal to us that we haven't yet created the conditions necessary for all students to succeed. For example, one of our goals in our strategic plan is that 80% of high school graduates in Orange and Osceola counties will enroll in college after graduating from high school. Not necessarily at Valencia, but somewhere in a post-secondary institution. I'm often asked if I believe that everyone needs to go to college. And my honest answer is no, not everyone needs to go to college to be happy and successful, but it is critical that each student makes that choice, that someone else doesn't tell a student that they're not college material, or that the student doesn't assume that college is out of reach due to financial reasons. Everyone should have the real option to go to college. And college doesn't necessarily mean earning a bachelor's degree. We offer accelerated skills training programs that are 10 weeks in length and prepare individuals for jobs that are in high demand in our community. We look forward to continuing to work in partnership with you to create the conditions necessary for everyone to pursue their goals and dreams in Central Florida. Thank you.
Thank you, Dr. Plinsky. Any questions from the delegation?
Chair Bracey, I just want to say congratulations to your leadership role, and we're really excited to have you at the helm, and I'd love to meet with you. I talk to Jay all the time with Valencia College. Would love to just connect one-on-one. And I know that Valencia College, alongside other public and state universities, have received federal support as well for students. We've been trying to promote that. But it's been really exciting to see enrollment, especially at Valencia, stay very strong, because I think it also speaks to new career paths that many members of our service economy have been pursuing. So I love to sit down and just kind of talk more about the trends you're seeing and what we can do to make sure that every Central Floridian who is looking for that next chapter can afford it and have the opportunity to pursue a new career path to support themselves and their family, especially knowing some of the talent gaps we have here in Central Florida.
Very good. Thank you so much for your support and look forward to that conversation.
Thank you. And Rep, go ahead, Rep Smith.
Thank you. Echo what Representative Escamani has said. Congratulations and best of luck in your new role. I look forward to possibly being able to meet one-on-one with you as well. The East Campus of the Valencia College, of Valencia colleges in the district that I represent. Also kind of talking on the issue of staff and adjuncts. I know that adjuncts were successful in their organizing efforts to create a vote to approve a union, which I think is a great thing, and I applaud them and congratulate them on their efforts. I was hoping that maybe you might be able to give, I don't know if you have any updates, but if you have any updates on the negotiations with those unionized adjuncts, and I guess what the plans were for Valencia College on increasing pay for those adjuncts who often live in or are basically living on poverty wages and also benefits as well.
Certainly, and thank you for those comments. We are very early in the stages of our collective bargaining process, and in fact, our first meeting is actually scheduled for September 10th. So that will be our very first meeting between the negotiating team. So that obviously is something that we're taking very seriously, and look at how we can ensure that we have strong and competitive pay and benefits for all of our employees at the college. Understanding, of course, that we have limitations in terms of funding that's provided both by the state and by student tuition revenue, and it is essential for our mission as well to ensure that we are maintaining affordable options for higher education in our community. So certainly balancing those different components, but looking forward to those conversations in the months ahead.
Thank you, Dr. Plinsky, and congratulations from the entire delegation. And we look forward to connecting with you. Jay does a great job of keeping us abreast of what's going on with Valencia and how we can continue to work together. So we look forward to the continuing partnership. Thank you so much for being here.
Thank you.
Dr. Cartwright from UCF, the new president.
Senator Bracy, Dr. Cartwright had to leave, but Janet Owens is on the call to represent UCF.
Okay, Janet Owen, you are recognized. Janet Owen from UCF, you are recognized.
I certainly appreciate it. First of all, President Cartwright does extend his apologies as he was called to another meeting that he couldn't get out of as a national interview, but he does look forward to meeting with each one of you individually to talk about his vision for UCF and its future. But on behalf of 70,000 UCF students, 12,000 faculty and staff, the Board of Trustees, we thank you so much for your leadership and your support. We, again, this year are on track to graduate another 17,000 students who are ready to enter the workforce as employees or entrepreneurs, providing opportunities for others. In fact, 94% of UCF's most recent graduates have an immediate plan for either employment or graduate school at the time they walked across the stage. 90% of our graduates remain in Florida, with 73% remaining right here in the 11-county region that we call Central Florida. By pairing academic excellence with access to opportunity and partnerships with industries across the full spectrum of sectors, UCF provides tremendous return on public investment and is the university for Florida's future. As we continue our progress toward ever-increasing excellence and impact, we would like to highlight the following funding requests. On Wednesday of this week, the Florida Board of Governors will consider the requests of 9 universities that are included in their University of Distinction pillar. UCF has again submitted our initiative to power up Florida's high-tech economy, building on the existing strengths of our College of Engineering and Computer Science. We will see what the Board of Governors recommends for our funding request, but when they do, we can promise you that we will drive even more discoveries and advances to support a wide variety of high-paying, high-value industries in areas such as cybersecurity, space, defense, engineering, power systems, and entertainment and tourism. We will also increase the quantity and diversity of 21st century workforce preparedness of desperately needed STEM talent. And we really appreciate our partnership with Valencia and President Plinsky's new leadership, because we work together to increase this talent pipeline. Next, we look to advance the medical education and healthcare in Central Florida to improve public health, address healthcare disparities, and expand research, meeting the needs of Florida's increasingly diverse and aging population. A $5 million recurring appropriation would allow us to hire crucial clinical and research faculty that better prepare our graduates, build more residencies and fellowships to address Florida's physician shortage, and lead the work of our emerging Cancer Research and Treatment Center. In service to an increasing number of veterans, first responders, active duty service personnel, and others suffering trauma, we are requesting $515,000 in recurring support for vital no-cost treatment provided by UCF Restores PTSD Clinic, which notably provided mental health support to first responders at the condo collapse in Surfside this year. In construction funding, we're seeking $15.4 million to renovate Biological Sciences building and $1 million for renovating our chemistry building. That would get that started. And we're seeking renovation funding under the $350 million pot provided in the 2021 legislative session for deferred maintenance. As always, we're happy to provide more detail on these initiatives when we have more time, but we thank you for your leadership, your partnership, and we look forward to working with you in the 2022 session. Thank you.
Thank you very much, Ms. Owen. So, any questions from the delegation? Yes, Rep. Smith.
Thank you. And thank you, Janet, for joining us. Please send President Cartwright our regards. And thank you for hosting us on campus a couple weeks ago with Senator Shepard Jones for his higher education tour. It was a great conversation. A question for you to continue a dialogue that we had there about mask behavior for students on campus. I know that that the way that you characterize the policy on campus is that while masks are not mandatory, they are expected and that they are strongly encouraged. How does enforcement of a strongly encouraged and recommended mask policy play out on campus? I'm hearing from a lot of constituents and students that there's lots of mask-free events that are happening across campus, and folks are concerned about that type of behavior and what it can do for local COVID cases.
Well, thank you, Representative Smith, and I'll look forward to talking with you further about what you're hearing. I can tell you that we're super proud of our students, because if you were to walk around the campus, you know, what we're seeing when we do is that our folks are acting as if there is a mask mandate. Everyone, most everyone is wearing masks. We have a rigorous campaign advising them to do so, and they are. We have a vaccination rate of over 70%, which is higher by far than the general population. We're monitoring the health of our campus 24/7, and if things were to change, we would of course respond appropriately per best, you know, expert medical advice available. But if you're hearing other things, we'd love to talk to you about that.
Thank you, Senator Stewart. You're muted. Senator Stewart, you're muted.
Forget. Thank you so much, Janet. You're great. I just wanted to mention that Senator Broxton and I will be coming to do a visitation on campus, and he does chair the Education Committee on the Senate side. And I suggest that you be on that golf cart or van or whatever it is that we're taking, and you can go over all these figures with him. So thank you again. I hope we can find some funds for you.
Thank you so much, and I really appreciate that, and thank you for your support and your work with him, because that's why we had a great session last session, and we can't thank you enough for encouraging him to come, and then for hosting and coming with him. Really appreciate it.
Thank you, Janet. I'm a proud alum of UCF, and we are here to support the university. So thank you for being here.
Thank you.
I actually have a question real briefly. This is Representative Brown. How are you?
Oh, good. Thank you.
I wanted to just get sort of an overview of how, just with the number of cases that are going up and managing those within dormitories, wanted to get sort of a overview of the protocols that are going on, to where if there is an outbreak, how are those students quarantined within your dormitories?
Sure. And we have an extensive protocol about that. And what I would be happy to do is share that with you, either, you know, in writing, or have Dr. Dyken talk to you in detail about that, because there's, you know, testing to go in. There are rooms available when quarantine is necessary, and we can certainly talk to you about that and how we are keeping up to date with that information.
Thanks so much.
Thank you again, Janet Owen, for being here.
A quick question. I'm so sorry. Thank you. Thank you so much, Janet. I know you and I spoke just last week, actually, about some UCF issues, which I appreciate always your access and your time. I want to real quick just lift up the American Rescue Plan dollars that came to UCF as well. And I'm curious if we have any stats, and this can maybe be provided offline, but of students who've tapped into that resource and what we can do, if anything, to help promote it to students as well, so they're aware that financial support is potentially available. And then also, I know last year when the pandemic first started, one of the biggest issues myself and Rep. Smith were working on what had to do with the off-campus student housing. And I know UCF also put some of the federal money aside to help those students with their leases because they were no longer physically present but could not break these leases. So I'm not sure if there's an update on, how many students were actually able to kind of use those funds to offset their leases, but I would definitely love to share that information because I think it does speak to efforts UCF is making to to help students with their academic success and addressing some of the financial burdens that they face.
Absolutely, thank you. We've been grateful for that funding, and then of course we received additional Hispanic serving institution for which we were super proud. So happy to give you an accounting. We keep obviously close tabs on every dollar, and happy to share that with you.
Thank you. Thank you again. We'll move on to Joseph Durso, Vice President of Public Affairs at Embrace Families.
Senator Bracy, I'm
Yes.
sorry. Joseph Durso wasn't able to join us, but Sarah Neems will be filling in for him.
Actually, here I am in the flesh, Mr. Chairman, so I apologize for the confusion. Sarah Neems, who many of you know, is going to do the presentation, but if it's okay, I am here and present.
Go ahead, Joe. Good to see you.
All right, good to see you, sir. Thank you very much. And members, thank you for the opportunity. First and foremost, want to start off by saying thank you. I've had the privilege of working with a number of you over the many years that I've been with Embrace Families. And we recognize how supportive our legislative delegation is of not only the child welfare system, but of the children that are in the child welfare system. And so we are genuinely grateful for all of the work that you all have done on our behalf and on behalf of the families that we serve throughout Central Florida. There are 4 main issues that we wanted to discuss really quickly with you all. The first is Keys to Independence. That's a driver's license program that I'm sure many of you are familiar with. It's not the first time that most of you have heard about it. When we started this program about 6 or 7 years ago, there were 12 kids in the entire state of Florida in the child welfare system. Of the thousands that were eligible for a driver's license, there were 12 that had one. Today, there are almost 3,000 kids that have a license or a permit in the state of Florida. And that's because of the work and the support that you all in the legislature have given us and given this program. It's worked so well, in fact, that we are actually talking with members of Congress to make it a permanent part of the federal HHS budget, where every kid in America will have an opportunity, if their state chooses to create a program like this, every kid in the foster care system who's eligible will be able to get a driver's license. We were able to get a little bit of it done last year and the COVID package at the end of the year in December. But this year we're working with Representative Davis in Illinois and Representative Bacon in Nebraska to make it a federal project or program. And that's really all due to the support that you gave us initially a few years ago. The second issue is Medicaid. So many of you know, we've spoken with many of you about allowing children in Medicaid. Every kid in foster care already receives Medicaid. They're already on some kind of state insurance. So this isn't an expansion of Medicaid per se. This is making sure that kids are getting the right Medicaid. When we created something called the Child Welfare Specialty Plan, it's a Medicaid plan specifically for kids in the child welfare system. There was an oversight. We left out kids in guardianship. So there are about 5,000 kids in the system of care who have the same issues as traditional foster kids, the same issues as traditional adopted children, but they're not eligible for the same quality care that comes in the child welfare specialty plan. And so we're asking that category of children be added to the eligibility for the child welfare specialty plan. In the grand scheme of things, we're talking about 5,000 covered lives, which is really minute compared to the overall Medicaid population. And so we'll be coming to see all of you with regard to that throughout session. 2 more really quick items. Pathways to home. I've heard a lot about affordable housing, a lot about homelessness on this call. Obviously, those are issues that we are very concerned with, especially as it relates to at-risk children. And so we have a really successful program that started in Seminole County. We are expanding it into Orange and hopefully Osceola County, called Pathways to Home. It's served literally hundreds of families at this point. We're looking for an expansion of the funding for that program to serve an additional 10 families or roughly 80 people. Because we've seen with COVID and some of the impacts of COVID, we've seen an exacerbation of that problem. And so Representative Smith will be bringing back, Representative Smith from Seminole County will be bringing that back. I want to make sure I don't want Representative Smith to think I'm putting him on the spot this morning. Representative Smith from Seminole County will be bringing that back. It's approximately a $500,000 budget item. And then finally, we support the juvenile expungement bill that many of you sponsored. I think Representative McCurdy, Representative Escamani, I don't remember who else, Representative Brown, I think were supporters of that bill. We recognize the importance of that bill. Kids in foster care, just speaking from our industry, children in the foster care system already have the deck stacked against them in a lot of ways. This is just one more hurdle that will make it harder for them to assimilate into society, become productive members of society. And so we fully support moving in that direction, and we support that bill. And we are working with Christian Minor and some of the other advocates to get this bill moving forward. And so with that, Mr. Chairman, I'm happy to take any questions. But again, thank you all so much for your support of the child welfare system.
Thank you, Joe. Any questions for Joe? All right, thank you so much for being here. I sent you a quick message in the chat.
Okay.
Joe, if you could respond.
Oh, great. Yes, sir. I'll do it.
Yeah, all right, thank you. All right, we're gonna move to Brian Abramowitz. How do I say that?
Abramowitz.
Say it one more time.
Abramowitz.
Abramowitz, got it. Thank you so much from the University of Florida program. You're recognized.
Thank you, Senator Bracy. Good afternoon, everyone. I want to start by thanking the members of the delegation for this time. I'm with the University of Florida's Scientist in Every Florida School program. We are currently funded by UF, and we are a free program that helps teachers include working scientists into their classrooms and curriculum so that students can experience the spark of science and inspire their future careers. As I said, my name is Brian Abramowitz. I'm a former middle and high school teacher, now working for UF Thompson Earth Systems Institute and the Scientist in Every Florida School program. The Thompson Earth Systems Institute director is also on the call with us today, Dr. Bruce McFadden. Young minds are the future of Florida's economy. And in Florida, a big part of our economy is directly influenced by our environment through tourism and agriculture. Our program brings authentic and reliable science into public school Title I classrooms, which helps close the learning gap, close the access gap, and inspire the next generation of environmental stewards and prepare workforce-ready citizens for the county. If you're a numbers person, consider this. Over the past year, despite the challenges of COVID, in the program's second year, we reached 55,000 students throughout 1,800 scientist visits in 42 Florida counties. Now, starting our third year, we are appealing to you to help spread awareness in Orange County as we are ready to start supporting your teachers and students. We have had participation in some Orange County schools, plus the support from school district officials. Additionally, some Orange County teachers have participated in our teacher professional development workshops, where we focus on supporting teachers who are at risk of leaving the profession. But the reason we're here is to expand our awareness of the work that we do within the schools you serve. This is the first time we are talking to you about this program, and we want to let you know of the cutting-edge professional development we are doing for teachers, the real-world experiences for students we make possible lockstep with scientists from around the state. For these reasons, we ask for your understanding of the importance of this program and its future potential, and to be an advocate for the work that we do. In closing, the Scientist in Every Florida School is potentially a true asset and benefit to the constituents of our community. We hope you will support us as our program will continue to positively impact the people you serve. And with that, thank you so much for your time.
Thank you, Brian. Any questions for Brian?
And I'm sorry, Brian, if you already said this in your intro, but thank you so much for your work. That's so exciting. How many scientists do we have right now in Orange County doing this work? I wasn't sure if you stated that, but I'm just curious of what the reach has been in Orange County.
With regard to scientists or classroom visits within Orange County?
Maybe both. I mean, any of the stats kind of speak to what the presence has already been.
Sure. So within last year with the classroom visits, we had about 5 classroom visits reaching about 200 Orange County students. Over the past summer, we had 9 Orange County teachers participate within our professional development workshop. So we're starting to see and get that ball rolling within Orange counties with regards to teachers and students. We would just love your support with spreading awareness so we can reach more teachers and more students.
That sounds awesome. Definitely count my office in to help, and you're welcome to send us more resources so we can do that.
Thank you so much.
Okay, well, thank you, Brian, for being on this call. We appreciate you telling us about the University of Florida's program. So this concludes all of our speakers, members of the delegation. What we were going to do is move on to our election of officers for the next coming year, but we're going to delay that for the afternoon session. I am going to move the time to 2 p.m. Michelle or someone in the office, please let me know if that's okay. I wanted to give everyone an hour and a half. So we
That's fine.
Okay. So that's what we're going to do. We're going to adjourn and come back on at 2 p.m. Does that work for everyone? Great.
Yes, I did ask a question. I sent Michelle an email to ask because I needed a panelist code to enter this morning session. Is there a separate code for the afternoon?
There is no code. You should be able to just click the link and be put
Okay.
into the meeting.
I did ask for a panelist code for some reason this morning, but thank you. So I'll see everyone at 2.
All right, 2 o'clock. Thank you, everyone.